Now, following a thorough observation of the processes leading up to the initial admission of patients for the Operation Set the Captives Free initiative at the Pantan Mental Hospital, Citi News journalist Christopher Kevin Asima delves into the country's mental health state. Here is the report read by Hansen Ajiman.
Mental illness isn't a singular disease, but encompasses over 300 different conditions, often emerging during adolescence. The lack of recognition and proper treatment during this critical phase can lead to persistent issues in adulthood, greatly impacting daily functioning. Surprisingly, 75% of adult mental health conditions originate in childhood and adolescence. The United Nations Sustainable Development Goals emphasize mental health's critical significance. Dr. Frank Bannon, Pantan Hospital's medical director, stresses the vital role of sound mental health, crucial for handling stress and maintaining healthy relationships.
When you look at the prevalence of the disorders within mental health in the form of a pyramid, you realize that the very common ones are at the base. So things that nobody talks about, like anxiety disorders, they are very common. Things like depression, they are very common. Okay, especially post-COVID, anxiety, I'm sure reached pandemic levels, if I should put it that way, because everything about COVID were things that were going to make you very anxious, especially if you were a health worker going into the hospital and coming back home. And some of these will linger on. So you would realize that the burden of very common mental disorders have gone up. And the WHO reports that it's gone up to probably about 25% more than pre-COVID period.
As a fundamental human right, mental health deserves the same respect as physical health. Upholding the rights of those with mental illness should be a priority, yet stigmatization and discrimination often violate these rights.
Persons with mental disorders also have rights because they are human beings. They have rights to life, they have right to environment, they have right to protection, and they have right not to be discriminated against, and they have a right to medical treatment. And so the only way we can ensure that they enjoy this right fully is to be able to have a very clear-cut legal framework that backs the hospital to ensure that they are forcefully taken in and reformed. And of course, that framework will then prescribe circumstances under which they could be discharged after they have been treated.
The Mental Health Act of 2012, Act 846, aligns protections for individuals with mental illness contingent on society's understanding and recognition of mental health issues. Pantan Hospital's Operation Set the Captives Free initiative is a step towards supporting these individuals.
Usually it has to do with us identifying homeless mentally ill patients in the streets, bringing them into the hospital facility, assessing their needs. And these needs are diverse. It could be medical needs, it could be psychological needs, or even social needs. And based on the identified needs, we go ahead to institute a management plan for them, whilst we keep them in-house and treat them. So by the time that they are regarded as well enough, we start introducing them to other treatment modalities like occupational therapy, where they sharpen their skills to be able to do things for themselves.
Achieving the initiative's objectives necessitates collaboration among policymakers, healthcare professionals, family caregivers, and those living with mental illness.
This one is everybody's business, okay? Not only local government. I think every employer should be involved, every individual in this country should be involved. We should be all concerned, because today it's them, it could be us at another time. And I think the next thing we're planning to do is to call for a stakeholders engagement. For example, local government, like you mentioned, okay, we know they have this disability fund. Are they willing for us to treat the people in their communities where they will fund for the treatment? Because one of the biggest challenges we have is when these people are reintegrated back into their communities, follow-up. Sometimes even what to eat is a problem. How much more what to take to hospital?
Moreover, the government must allocate resources and infrastructure to ensure mental health rights are honored. This involves training professionals, expanding services, conducting awareness campaigns, and involving the media in mental health education.
I am hoping that the Ministry of Gender, Children and Social Protection would work together with the Mental Health Authority to join in this campaign to ensure that we rid our streets of persons with mental disorders or persons with mental disability.
Investing in mental health yields returns ranging from 6 to 8 units for every unit spent. Neglect, however, can lead to a 7% loss in GDP. Therefore, policymakers should allocate adequate resources as exemplified by some countries with dedicated ministries for mental health.